Governor Jennifer Granholm and former GOP Senator and presidential candidate Rick Santorum. Senator Santorum, is it hypocritical for the president to use more executive actions when he was so critical of President Obama for them?
The answer is, I would say yes. I mean, if you're going to go out there and criticize someone for using executive orders and then you use them yourself, then you should suffer the consequences of your previous statements. I think both President Obama and President Trump, as you just mentioned, are very frustrated that Congress didn't act. Frankly, I don't think that's a good reason to use executive orders, but both of them did.
But you support the ideas behind this executive order?
I do. No, I think what the president did with respect to suspending Obamacare CSR payments, cost-sharing reduction payments, was the right thing to do. Look, the district court was very clear. I think if they had appealed it up, it would have been confirmed by upper courts. There's no authority that the president had to spend this money, and they were held off, I think, as long as they felt they could, with a credible face that they're pursuing the litigation, to the point where they said, we're not going to do this anymore, and Congress, you need to fix this. You want the money, you need to fix it. And what I think President Trump realized that the Democrats are not interested up until this point in fixing it, because why buy the cow if you can get the milk for free? They were getting these payments. They didn't have to give up anything in any kind of deal to continue the payments coming. Now the milk's not free anymore, and we'll see whether they're willing to buy the cow.
Governor Granholm, I saw you tweet earlier today. You said, hey, at real Donald Trump, killing health care for millions of average folks, feel better now, privileged billionaire, happy to hurt real people. Isn't dismantling Obamacare, however, exactly what he promised to do and what people elected him to do?
Well, dismantling Obamacare and replacing it with something. So they haven't been able to replace it. And so what the effect of these two executive orders that he's issued in the past couple of days has been is to put real people with real pre-existing conditions or health concerns, their interests are completely subsumed by his rabid desire to dismantle whatever Obama has touched. To me, what he's engaged in is active measures to vandalize the health care of millions of people. So if it's supposed to go back to Congress, fine. We've got Republicans and Democrats who are willing to work on fixing whatever he's done, but whatever before existed that needed to be fixed in Obamacare. Let's get it fixed. There was just a poll that was issued by the Kaiser Family Foundation, and even Republicans, by a 5-point majority, do not want him to dismantle the Affordable Care Act. They want him to fix it.
Senator?
Well, here's what I would say, that we're going to see a test coming up here in the next few weeks, because these cost-share reduction payments are stopping. It's going to affect people who have silver plans. If you have a bronze plan or a gold plan under Obamacare, you don't get cost-share reduction payments. So only a sliver of the market gets these cost-share reduction payments. Well, again, it depends on what kind of plan you have. I mean, it could be lower income people have bronze plans or less expensive plans. But the bottom line is that we're going to see whether the Democrats are serious about actually trying to do something. Because if their answer is, give us the money, but we're not willing to make any changes to make middle class, to use your term, to make. But it is what they said, because they've rejected any type of flexibility that actually is going to lower rates for people who are out there on their markets right now who don't get subsidies from the federal government. You're talking about small business people or people who work for small businesses. You're talking about middle-income Americans who've seen their rates go up by double in the last couple of years. I mean, you're talking about huge increases, and nothing's being done, and Democrats are resistant in making any structural changes to Obamacare to make that happen.
You are not listening. I don't know what's in your ears, but you have not been listening to what Democrats have said. They have been saying, fix it, mend it, don't end it.
What have they proposed,
together in a.
Other than more money, what have they proposed? What have they proposed?
There has been a bipartisan proposal that, Senator Alexander and Senator Murray have been working on.
I have looked at that proposal in great detail.
Oh my gosh.
I've looked at that proposal in great detail, and there is absolutely
fixes, including
Go ahead, Governor.
Including allowing the government to negotiate for the reduction in the costs of prescription drugs, including making sure that there are carrots and sticks to get more insurers into the market, including making sure that you provide incentives for more people to sign up. What the president has done has gone in the exact opposite direction. This so-called freedom you described, that was tried in a half a dozen states in the 90s, and all of those plans failed miserably. They were undercapitalized, and they were also used by ne'er-do-wells to try to put these scam subprime insurance policies on the market. And you're going to see, after this, you're going to see attorneys general across the country bring lawsuits. Why can't we get a fix? And Rick, you cannot say that Democrats don't want to fix it.
I want to give you the final word.
In fact, I can say it because I've looked at the Alexander and Murray proposal. And
I am telling you, they want to fix it.
Yeah, all I'm telling you is what the facts are, that the proposals that have been put forward by the Democrats have been almost zero reform. You've mentioned several things you mentioned are basically more money to be pumped into the system to bring more people in. But as far as structural changes to the insurance markets, so the people who don't get the subsidies are actually going to have lower costs, nothing's being done because that requires a change in the fundamental structure of Obamacare. Ron Johnson and Mark Meadows, two folks who have been working very, very hard on trying to put together a Republican proposal along with others in the House and Senate. I think are going to be introducing a plan next week that has common sense reforms in there. Things like that we're going to have prices being published, prices for services and products being published. Those are the kinds of common sense things they're going to put forward that can lower rates, and we'll see whether Democrats come to the table or whether they come up with phony reforms that are going to do nothing to reduce costs.
Have the Democrats come in, let them do it, because they were willing to negotiate.
Governor Granholm, Senator Santorum, I appreciate it, both of you. Thank you. Coming up next.